Hi, everyone, and welcome to what I believe is going to be a very, very special interview for you all today. And it's going to bring tremendous value to your Regenerate business. Before we get started today, for those of you who I have not yet met, my name is Sonja Schoonerberg, and I am the VP of Product Experience for Regenerate. And I also have the very distinct pleasure of running my own team of incredible healthcare consultants and very brilliant physicians, such as one of the ladies you will meet here momentarily. So I would like to take a moment to introduce you to Dr. Serena Satcher. Dr. Satcher earned her medical degree from Meharry Medical College in Nashville, completed her residency in internal medicine at New England Deaconess Hospital, which is now Beth Israel Deaconess Hospital, and a second residency in physical medicine and rehabilitation at Loyola University Medical Center. She is board certified by the American Board of Physical Medicine and Rehabilitation, the American Board of Integrative and Holistic Medicine, the American Board of Integrative Medicine, and certified by the Institute of Functional Medicine and subspecialty boarded in sports medicine. Dr. Satcher is the owner of Regenesis. I love the name of that because it sounds a lot like Regenerate, Health and Wellness in New Jersey, where she specializes in many areas of functional medicine, such as arthritis and autoimmune conditions, metabolic disorders, hormone rebalancing, neurodegenerative diseases, and weight management. I could not be more excited about this interview today because I think many of the things that I just mentioned are the things that a lot of the patients that need Regenerate are suffering with. So Dr. Satcher, thank you so much for your time today. I'm really excited to learn a little bit more from you, and really excited for our field to get to know a little bit more about how you help people and what you saw in your vision with Regenerate. So why don't we start here? I'd like to learn a little bit more about why you chose to become a physician, and more importantly, what led you to down the path of functional medicine. Tell me a little bit more about that.
Well, I decided to go to medical school because I was interested in helping people regain their health. And I have a relative, I have an uncle that's actually kind of prominent, or he used to be prominent. He was the former Surgeon General of the United States. And yeah, I don't think
that's amazing. You're
but
famous.
my family's famous.
That's right.
So I went into he's part of the reason why I went into medicine, and he was part of my inspiration and has been a mentor through the years. But something that I noticed, I was interested in science, biology, in school, and math. And I was interested in the healthcare field. And I noticed that he was very focused on nutrition and lifestyle issues like exercise. And he still is to this day. So, that was definitely an inspiration to me growing up. And when I went into medicine, and when I did my first residency in internal medicine, I was a little bit discouraged when I started practicing. I practiced for a year before I went into physical medicine and rehab. I had a lot of patients with diabetes and asthma and high blood pressure, and it just seemed like a revolving door of people just coming in for prescriptions and not really making any other changes. In medical school, they really didn't spend much time at that time teaching about nutrition. But I knew that it was important, and I did some side stuff like when I was in medical school that wasn't really in part of our curriculum, but it helped me to learn things like, how to help people that were in rural areas, how to help people who, may have been economically disadvantaged or not have high incomes, and how they could help themselves to get better. And nutrition is like a huge part of that. So if people have access to food, then they can make choices about food and nutrition. So, that's something that I developed further after I got out of medical school. I did, you were reading my credentials. I've done a lot of education in nutrition, in functional medicine, in integrative medicine. So, that's what's in my background, and that's what motivates me. I've seen with my own health a lot of improvements in changing my nutrition. So I know that it works. I've helped a lot of patients. When I was primarily in Virginia, I helped a lot of people to reverse their diabetes using nutrition and using functional medicine.
I love that. As a registered dietitian, nutritionist, and certified diabetes educator, one of the things I used to do when I was in practice is I would work with residents of a family practice residency program. And I would come in, I think once per rotation, once per year per their rotation, and I would give a little talk on nutrition. And it always amazed me how very little they were taught about nutrition in medical school. And I always thought, well, as a dietitian, it was very much the opposite. I was taught food is medicine, and therefore, why would physicians not be trained in the areas of nutrition? So there was always that disconnect. So I think the reason that I appreciate connecting with functional medicine physicians so much is because I feel like we're all kind of on the same wavelength. I've learned so much from practitioners, not only yourself, but others in your profession, and so grateful that we get a chance to work together. So thank you for sharing a little bit more about your journey. And that leads me to kind of how we met. And that, of course, was very, very recently through LinkedIn. And I remember our first conversation, and you said to me, which I thought was very, very interesting, I've been looking for something like this, in meaning regenerate, to everybody that's listening. Would you elaborate a little bit more on exactly what you meant by that?
So I've been in functional medicine since 2004. And I was in the first cohort of doctors that got certified by the Institute of Functional Medicine. And things have evolved over the years, and we have testing where we can look inside the cell and see nutritional deficiencies pretty accurately. Most of the testing that we do in conventional medicine does not accurately indicate problems with nutrition, which is kind of interesting. But what I've noticed over the years is that certain patients, even after they have done things to heal their quote unquote leaky gut is what we call increased intestinal permeability, which has actually been around in the GI literature for a long time. But it wasn't recognized as leaky gut until more recently. But you can heal up leaky gut and still the person will have nutritional deficiencies, or maybe their leaky gut is not healed completely. And you're wondering like, well, is it stress, or, is it the form of the nutrient? So I learned a lot about genomics. I have spent time with patients. There's the non-traditional way of getting like 23andMe or Ancestry and running that data through apps like Genomic Genie or other apps, and seeing reasons why some people may be having problems metabolizing certain forms. An example that I'll give that conventional, any doctor will recognize is B12. In conventional medicine, you have access to cyanocobalamin, you have access to methylcobalamin. So those are typically the two forms that most physicians will give. And when people are not absorbing, they may start giving it IM, which can actually be detrimental to people. There are certain single nucleotide polymorphisms, and we're not sure like about the dosing. We don't know, right? So we're kind of playing with fire, but we know that certain single nucleotide polymorphisms metabolize certain vitamins differently. So there's also adenylyl cobalamin, and there's also hydroxycobalamin, which are other forms of B12. They're in the metabolism. And so, and that we can over-methylate people by giving them too many methylated vitamins, and that can increase people's risk of disease. So in the past several years, me and one of my friends that I work closely with, who's also a functional medicine doctor, we have had discussions that we noticed that certain food-based vitamins, certain people seem to do better with, right? It's not across the board, but it's certain people. So the thing is that if we just think logically, it would seem that we should be able to get our nutrients from food if we have the right foods and in the right amounts. So I was already thinking that before I came across you on LinkedIn and Regenerate. Like, I was already thinking this is what we need for the patients, and to be able to use the genomics, and this is in an indirect way. And I was already familiar with hair testing. I was familiar with the work of Dr. William Kelly. I was familiar with the work of Dr. Nicholas Gonzalez in terms of nutrition and the genomic influence, and how certain nutrients travel together, like minerals, certain minerals and groups of minerals travel together into the inside of the body and go into the cells in groups. And they are in those groups naturally in foods and in fruits. And if we're able to like put some package together, right, then that would be the ideal situation. And I know I'm kind of running on, but when I got my own result back, this just further solidified and cemented that what I was thinking was true, because I knew from testing years and years ago what my deficiencies were. I knew from my genomics testing that I had a tendency for certain deficiencies. I have taken those supplements over the years. Some have worked, some have not. But it was interesting that some of those deficiencies were still there. And I'm expecting for those deficiencies to go away as I, take the superfood.
I love that. And I had all kinds of light bulbs going off as you were talking. I know I've shared my story in the Epstein bar, and those of you in the field, most of you have heard my story. And I had a lot of those same light bulb moments. When I did my very first epigenetic hair analysis test, I looked at it in true disbelief and thought to myself, how can this be? I've been swallowing all these pills, literally 30 of them a day. How is this even possible? But when, and you and I have talked, when we get back to really the foundation of food as medicine, we know that food is metabolized much differently than any type of pill that we swallow. It doesn't matter what type of grade it is or pharmaceutical, if it comes from Walgreens. I know that obviously there are certain supplements that are better than others, but when we get down to the granular kind of nooks and crannies of what a supplement is versus what a food product is, there's a tremendous difference. So thank you for validating everything I've believed. And I think that that's a very, very powerful message, that not only are we looking at something very simple and relevant and where the world is heading in terms of epigenetic gene expression, but now we're able to pair that with an actual solution that's personalized for you, for me, and for everybody. So I know you were also really excited to share this with patients because of some of the things that you just mentioned. But also, take me into the world of a patient. I know how I've experienced life as a patient, but take me into the world of a patient and why you believe that this is going to be really a solution for a lot of the things that they're struggling with.
So the pain points, or what comes up with patients right now, I would say number one is stress and lack of time to pay attention to themselves. People are spending more and more time working, and less time at home. In the areas of the country where I see patients, they're spending a lot of time commuting. So not only are they working more hours, but because of finding affordable homes and housing, like they're commuting an hour, 2 hours sometimes, on the train or driving. And so there's no time for like meal prep, or they have to totally, I would say that's one of the hardest things for people, is like totally trying to rework their schedule and their lifestyle to try to get in healthy and nutritious food. Um, and so, I need to try to simplify their prescription, like like you were saying, taking 30 supplements, it's really difficult unless someone is like not working to do that. And it is difficult for people that have families too, and requires like, the mothers have to totally restructure what they're doing in order to figure out a way to do the meal prep and everything. So anything that can be done to kind of consolidate these tasks and, eating the right foods. I mean, I just reviewed a result with a patient this afternoon, and the fact that the report has on it the foods that are in the category that are the priorities for the patient, it's very easy for them to understand. I reinforce that in addition to those foods being in their superfood supplement, that they need to try to shop for those foods and try to eat foods and eat the variety that they have not been eating. I don't know if you're familiar with Dr. Terry Wall's research. She's out of Iowa, and she's at IU, and she's also at the VA there in Iowa. And she's done research not only on what she was having a problem with, which was multiple sclerosis, but also she's done research on metabolic diseases, neurodegenerative diseases. And in fact, she's figured out that we are not eating enough fruits and vegetables, which we all kind of know that's true.
Shocker.
But the average person thinks that 2 or 3 servings a day is enough. And what she's shown with her research is that it's more like 9 to 12 servings, and that most people in the United States are not getting enough. And so any kind of direction towards trying to get in, especially more vegetables on a daily basis. And, there are many companies that have these vegetable powders, like the green powders and the red powders, which have become in the past couple of years very popular. But having a superfood that's customized and personalized for the person based on what their needs are, I mean, this is like the ultimate. This is the future of medicine. This is where it's going. You talked about functional medicine doctors, but I see that mainstream doctors are desiring to know, what is it that we're doing? Many of them are older, maybe like over 40, and they're not really interested in going back to do all the training that I did, for various reasons. But this is something that any doctor can implement quite easily. And you don't even have to really understand that much about nutrition. You don't have to understand that much about deficiencies. When you look at the report, it's very simple. The patient can actually look at the report themselves and begin to understand where there are deficiencies and where they're having problems. So I think this is where it's going. Food is medicine.
I love that. So I heard one word that came across multiple different ways, and that's the word simplicity. So simplicity for the patients. And I mean, I think back to when I was taking 30 pills a day. At the end of the day, I would find some still sitting on the counter and, think to myself, oops, I forgot to take those. And I can only imagine as a physician, if you've asked patients to take all of those and they're forgetting, And then they come back to see you and they're still struggling with the same things. And they say, you know, doc, I can't take 30 pills a day. That's too much. I mean, there's, you know, fatigue and burnout from swallowing pills. It's a real thing. I've been there. But, and then also simplicity for you as their provider, and not, you know, being able to, you know, tangibly have a report that they can understand and that you can easily explain and takes very little time. I mean, I think that's the other thing that I've learned in talking to physicians is that the time factor has got to be there. If there is something that requires a huge explanation, or there isn't a tool to explain it, or it requires this, you know, very long drawn out procedure. I mean, there's all of these factors come into play when you make a decision on what to share with a patient. So I know we've talked about really just the simplicity for you as a physician, but also for the patient, and making sure that they get the right things. I think it simplifies their trip to the grocery store as well. To your point, they have a list at least to work from. And what I always tell people is, you know, look for the things that show up in multiple categories. And those are the things you want to make sure you add to your grocery cart. And now they're like, yeah, I can do that. You gave me something very simple that I can work with. And then of course their Optimate, they have to take it once a day. I think that's been a very big selling factor, at least when I've talked with physicians, is that it's only once a day. They look at me in surprised disbelief, I think, when I say yes, once a day. And so a lot of them are very excited about that. Well, great. Thank you for sharing that about patients. And from your viewpoint now, I have a really good understanding. But you also began to open the door for another real problem that I believe physicians are struggling with. And we've had this discussion as well. And that is just the reality of what's happened in healthcare today. You know, when we were talking the other day, and I said something about at one point wanting to go to medical school, and you said, no, be an entrepreneur. It's, you know, it's a lot more lucrative. So, I mean, obviously we love medicine and we love helping people, but I think what's happened, unfortunately, to the state of healthcare is very sad. And physicians today have certain pain points that we, not only here at Regenerate, but in other areas of health and wellness, believe that we can help them with. So would you touch on really some of those pain points that physicians are struggling with, whether it be financial or time constraints, things like that? Would you mind touching on a few of those things?
So yeah, I would say 100% of physicians are going to identify with the time constraints. And no matter what field you're in, no matter what specialty, they don't have enough time to really help the patient. They have only enough time to either write a prescription or direct them to what they need to do preoperatively if they're a surgeon. But now, you know, not now, but all doctors are concerned about outcomes. All surgeons are concerned about outcomes. They want their patients to do well, but really the system does not encourage what's necessary to help the patient to do well. I always tell people, like, you know, what your insurance card gives you is medication or surgery. And what you need is you need education on how to take care of your body. You need education on what foods to eat, and you need education on what exercise is going to optimize your function, your physical movement and functioning. You also need to find some kind of mind-body techniques to complete the whole package that are going to work to help you to feel better over time. So the other pain point with the financials that I think is across the board too, because a lot of what doctors have gotten paid has stayed flat over the past 10 or 15 years. It hasn't substantially gone up. And so, and what we're seeing too is that the insurance is taking a bigger bite out of the reimbursement, so that it's causing doctors to be focused on productivity over the past 10 to 15 years of a certain negative type. Like, you know, the amount of time spent face-to-face with patients has gone down, 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 while the patients are stressed out and having more medical issues than they had in the past. The food quality, you know, just out here in an average grocery store, food in restaurants, food that people are consuming every day, quality has gone down in terms of the amount of nutrients that are available in the foods. So it's like epidemic what we see with mineral deficiencies, and that contributes to, you know, how much heart disease, high blood pressure, diabetes, that contributes to the diseases that we're seeing and the amounts of the diseases that we're seeing and the severity. So with the financials, what I always tell, you know, I have a lot of mentees that are kids that are in medical school or they're in residency, or people that are just getting out of training. And I tell them, even people that are thinking about going into medical school, I say, you know, first of all, you got to be focused on helping people. Go into it for the right reasons, because the financial is not really there. It can be there depending on what specialty you go into, depending on, you know, like if you're interested in research, but you really need to have a side gig, or what you consider a side gig, and it might become your main gig. You know, you need to have other streams of income, and especially like monetizing things that can be obtained in your office for sale. And if it's directed towards things that help people to get healthy, that's the best thing, because people are going to your office looking for ways to get healthy. Some people have the means, you know, for these options. Other people don't. But when they see that you're concerned about health, they'll start asking questions. And there's always information that can be gleaned, because even if the person can't afford to have the Optimate every month, they should at least get the testing to direct their nutrition. That's the minimal. And if a person has a job, they can afford this. If they have a job, they can afford the testing, and they can afford the superfood.
Yeah, so lots of great things came out of what you just said there. So a lot of our healthcare consultants are meeting physicians that are very, very busy. You know, they're seeing, you know, drug reps all day long. They're seeing, you know, 1 million patients and all these things, and, you know, working 80 hours a week. And to your point, the visit with a patient becomes more like, okay, what are the things that we really need to address today that I can get you in and out the door in 10 minutes? And therefore really not allowing that quality time. So I think what I've learned from a lot of physicians today is that they're looking for other means to supplement, to your point, a side gig, or supplement their bottom line in their practice, so that maybe they don't have to see, you know, 80 patients a day. That might be a little exaggerated, but you get my point. They can see fewer patients and be able to actually have quality time with those patients and actually practice healthcare rather than becoming more of a corporate employee, which is unfortunately what we see happening. So simplicity for the patient, it's very affordable for the patient, is what I hear you saying, compared to, and I know we've had this discussion as well, there's a lot of things out there, but a lot of them are much more expensive. And I think that every physician I've spoken with, when we start putting things into context of price, has really seen the value of information that the epigenetic signature mapping test actually gives people for the amount of money that it costs. And to your point, everybody should be on the custom superfood. And would you also agree, and this is kind of a side note, one of the things that we encourage our providers as well as our healthcare consultants to do is to actually put themselves through the program, because then you can intelligently speak to not only your results, but also have, you know, better empathy for what a patient might experience. Would you agree that's pretty important?
That's of the ultimate importance, and in all the integrative and holistic, you know, clinical areas, we always like experience the testing or whatever we're prescribing first before we prescribe it to the patients. They don't necessarily teach it that way in conventional medicine.
No, don't try the drug first, right?
Right.
Let's hope you don't have to. But to your point, nutrition is very different and you should experience it. So thank you for validating that. And then lastly, so kind of bridging off of what we were talking about, the financials, obviously, some eyebrows go up when they see, of course, the financial rewards that are attached to Regenerate. If you had to share with our healthcare representatives a few things that sort of stood out to you in terms of our compensation, and maybe how to articulate that to a physician, meaning that, obviously we have a very simple and, an easy to understand compensation plan. But I think the other piece is too, that it doesn't take a lot of time to understand it or to teach others how to use the protocol. So if we were to give, a couple of, words of wisdom to our healthcare team, our healthcare rep team, who's out there talking to physicians, but maybe a little bit nervous about talking about the money, show me the money as we speak. Can you maybe elaborate on why that is an important thing to talk to a physician about?
Yeah, because I think if it's a physician that's in private practice, they're concerned about overhead. So if they're assigning someone in their office to kind of take care of some of the paperwork or some of the online work that's involved with it, they're concerned about how much time that's going to take and whether they're going to be able to pay that person for that amount of time. And then also the same concern for if it's someone that's in like a group practice or like an academic practice or some other kind of practice. They know they have to have a certain level of productivity per day. So they may be concerned about that and how much time they're physically going to have to put into, getting the word out, marketing, or actually ordering the test or explaining the results. What I would say is that I have experienced prescribing supplements, and there are a few companies out here that have these big aggregate websites, and they do give you a commission, but it's not, as soon as I saw the result or the commission from the patients that I've gotten onto the program, I was like, this is significant. I mean, you guys were telling me before what it was, but then when you see the report, and the report's simple to understand, I was surprised, pleasantly surprised, because what you see from supplements is a much smaller amount. And I'm not really driven by the commission per se, but it does make it worth the time. And it doesn't require a lot of time. Especially, I think the doctors are probably going to be concerned about trying to come up to snuff on understanding the report. There's nothing to come up to snuff on understanding the report as far as the patient goes. The patient, all they want to know is what their deficiencies are and what they can do about it. And the report puts it very simply, and it's very easy to understand.
Thank you for that. And kind of in summary, you hit on something that was very, very relevant to a lot of the concerns that our representatives have, and that they think that the bigger issue is that sometimes we are not scientists. I mean, we all have different backgrounds, that we need to know everything about epigenetics and all that. I mean, really the granular detail, because our perception is that the doctors want to know it, so, and that they're going to turn around and then teach that to our patients. But what I hear you saying is that we want to keep it simple for the amount of time that you really have to put into something. Combine that with the reward, financial reward that Regenerate is offering, and the tools that come along with it. We've really kind of taken the guesswork out of everything. Mm-hmm. And I think, bringing that full circle for our healthcare representatives, I think is very, very key, because you don't need to know everything. We have resources. We have some of the best tools and things that are available for people to experience, to touch, to feel. But really, the moral of the story is to experience the program yourself. When you have a story to share, facts tell, stories tell. If I tell you, Dr. Satcher, about all the incredible results a patients are having what's more relevant, those success stories or the nooks and crannies, very granular detail about the product? Which is more
The,
life-changing?
the success stories. And I just want to comment on that I have studied the method that they use for this testing for years and years and years, like at least a decade. And so far, out of my friends that are in this area that could understand it, I'm the only one that understands the testing method. So it's not important to understand the testing method. And I think that's important for physicians to understand, because you all have the scientific papers on the testing method. However, if you haven't studied in this area ever, I can tell you, and even one of my friends who's an expert in genomics, she understands genomics, but she doesn't understand this testing method. And that's okay, because she doesn't have to. You don't have to. The scientists have figured it out and it works.
It's kind of like understanding how your cell phone works. We just don't go there. We just know it works, right?
Yeah.
With such valuable information. Thank you for all of this. So as we wrap up, I really want to thank you for your time today. Is there anything else that you can think of that we've left out or that you'd like to share with our healthcare consultants and our providers that you think is of value that we perhaps missed in our conversation?
I would just say that as far as providers go, I would encourage them to get the testing themselves as soon as possible and to figure this thing out within the next 90 days, because this information is getting out there and this is really where medicine is going. And if you sleep on this, you're going to be kicking yourself.
I love it. Thank you so much. Spoken from a physician to other physicians who are listening. So Dr. Satcher, I want to thank you so much for your time today. To everybody that's watching, I know you've gotten absolute value. If I could have been taking notes, I would have been, but I was busy talking. So I hope you took some great notes today, and we'll see more of Dr. Satcher. I think she's going to be a very, very integral part of Regenerate. So thank you again for your time. Have a terrific rest of your day, and we'll be talking to you soon. Take care, everyone.
Thank you.